Are you considering dental implants, but you want to make sure you get the best deal out there? And can it be confusing to see such a wide range in pricing? How do you know you can trust the information you're getting when every offer promises to deliver the experience and smile of your dreams? Here are 3 essential factors you need to consider in your research to make the cost of your dental implant solution a smart investment. The first tip: never choose a treatment plan based solely on price. This is an easy trap to fall into when you see prices much lower than the industry average. Now, everybody's heard the phrase, "you get what you pay for." Everyone knows that the lowest price doesn't always result in the best purchase. Everyone knows that quality matters when your purchase is really an investment for the long term. But when it comes time to put down the money, most people get caught in the trap of falling for the lowest price. Isn't that just the most foolish thing you can think of? When I say most people, this even includes me. I've fallen into this trap too. I've done this when purchasing a car or buying a computer. I'd buy a less reliable car brand for a cheaper price, and then pay a ton of money for multiple repairs, towing fees, time lost. And then when it was finally time to replace it, I'd go out and buy the same brand, even though I knew that a few thousand more for a more reliable brand would be much less than the fortune I had put into repairs on the last one. Well, I don't fall into this trap anymore with cars, and neither should you when it comes to your investment in a dental implant solution. So how do you know whether you're getting the most value for your money? Lean on the next 2 factors to help evaluate the true cost, not just the price of dental implants. The second tip is to understand the complexity of your case. What makes a case complex? In your surgery, do you need bone grafting, soft tissue grafting, a sinus lift, IV sedation? These additional procedures require more skill and can alter the cost of your treatment, particularly if another specialist gets involved. In your consultation, make sure you have answers to the following questions. Do we know if there is sufficient bone for the implant to be embedded in? If your gum tissue is compromised, you may want to ask, how do we know whether there is sufficient healthy gum tissue to help seal and protect the implant? Does the design of the prosthetic cause harmony with the occlusion? Does the placement of the implant ensure the prosthetic won't break down in the future? If you're not naturally curious wanting to know the why behind everything, just know that this is the time when that matters. How about medical conditions that need to be controlled during the surgery? Conditions such as sleep apnea, high blood pressure, type 2 diabetes, or failing kidneys. You'll want to be confident and ask your dentist how they would be able to mitigate those conditions without just disqualifying your case for treatment. Remember, the price of your surgery may take some of these details into account, and all of these questions will force your dentist to help you understand which surgical procedures are actually necessary and why. The third essential factor you should always consider when evaluating cost is to research the surgeon's qualifications and treatment process. Unfortunately, one of the leading causes of dental implant failure is improper installation. Without sufficient training, especially in complex cases, a dentist might place the implant incorrectly. Then there's the matter of making sure the dental prosthetic appropriately joins the new surface. Did you know that dentists are only required to take continuing education courses, seminars, or hands-on training programs before performing dental implant surgeries? So where does a proven track record come from? It comes from consistently performing a wide range of surgeries that advance in complexity. This helps prevent a variety of dental implant issues down the road. The trap, then, is to assume credentials alone are enough, and then overlook the lack of a successful track record. It's an easy trap to fall into because of our experience in other settings where we rely on professional expertise. Here's an example that you might relate with. Can you remember the last time you flew in an airplane? When the flight was booked, how much of the decision process involved verifying a pilot's credentials? If you're like most people, probably not at all. In fact, the only time the thought may have even crossed your mind is during the flight while hitting a rough patch of turbulence. I hope this is the airline's most experienced pilot, you think to yourself, while clutching the armrests. You see, when we fly, we just assume that we're safely going to reach our destination. And in pretty much every case, we would. In the airline industry, there are more than enough protocols and contingencies in place to make sure that happens. This isn't necessarily the case in the healthcare industry, where complications may not be detected until sometime after the surgery, when implants start to fail. Dentists don't always have the luxury of having a seasoned co-pilot on deck during each surgery. And experience counts when the unexpected happens, and the dentist is in unfamiliar territory. To avoid falling into this trap, get curious and ask questions that help uncover the dentist's expertise. Here are several questions you can ask the dentist during a consultation. What level of training do you have? What proportion of your casework involves dental implants? How long have you specialized in delivering dental implant solutions? What proportion of cases have you performed that are like mine? How many implants have you placed? How many bone grafting procedures? How many soft tissue procedures? What is your revision rate? The way the dentist welcomes or evades your questions and the information they give you can help you gauge whether the price of treatment really reflects the value of the treatment. There's the price you pay up front, and then there's the cost of your experience in the long run. If your implants fail, it can be costly to restore, not just in dollars, but in time, frustration, inconvenience, and sometimes pain or even a lack of confidence. Here are some things you can do to verify a dentist's track record. You'll want to see if they're showcasing their work. Go to their website, Facebook, or Instagram page. Do they have before and after photos? More importantly, are they actual patients of the same dentist who is doing your work? What do the patient testimonials tell you? Are they backed up by what you find when looking at Google reviews? The more feedback you have about their results, the more reliable it will be. 5 before and after photos or 5 reviews will not carry as much weight as 105. You may even go as far as asking about their reputation among other dentists or healthcare professionals. Every purchase we make is driven by how much value we can get. Unfortunately, we have a soft spot and tendency for basing it just on a price tag. The good news is that you can use these tips to help you make an informed comparison between treatments and feel confident when it's time to move forward with your dental implant journey. If you want more information about the tips shared in this video, contact our office here at Ohana Dental Implant Centers. We're happy to help.